Unlock the future of pathology with Pathology News, your ultimate source for cutting-edge insights, expert analysis, and the latest breakthroughs in digital and computational pathology. Don't just stay informed, stay ahead.
Hello and welcome to a Pathology News special. Today we're here in Berlin at ESMO 2025 and I have the honour of having Felix Faber, CEO and founder of Mindpeak, as well as Patrick Frey, who's the head of precision medicine over at Mindpeak as well. We're here to talk about Phenoscout AI and some of the work Mindpeak are doing in the space. Hello, welcome. How are you both?
Hi, thanks for the invitation. We're good. I'm good. I hope you're good as well.
Yeah, I'm also good. It's been a long day, but it's a great conference and we're really happy to be here.
Fantastic. Is it your first ESMO?
No, I think it's my third ESMO.
Okay.
Yeah, but by far the best one so far.
Yeah, I'd agree. And you, Patrick?
So my first was last year in Barcelona,
Okay.
but this year is a lot better so far.
Oh, good to hear that. And that's the general consensus I hear as well. So we're here to talk about Phenoscout AI. Maybe you guys can tell me a little bit about what Mindpeak are doing in the space and perhaps a bit of an introduction to Phenoscout AI.
Right, so we came to the MIF space a while ago and we were introduced around 2 years ago. And it was introduced basically by Zeiss, Florian from Zeiss. And we looked at the topic and the issue with the current multiplex immunofluorescence workflow is that it's actually not very reproducible on the one hand, and also getting data out of the slides through, let's say, an image analysis is really tedious. It takes hours, days partially, to get the data out of the slides that you want. So we thought there's so much super interesting information hidden in those slides. Usually you just have a chromogenic IHC, which gives you one biomarker, but you could look at cells that have multiple biomarkers in one cell, or you could have bystander effects in many different layers of tissue. So all of this is not being used today. All of this you can't not access only in research, but not in diagnostic routine.
Okay.
So we sat together and said, how can we make this awesome big fingerprint of each tissue available to patients? And this is when Zeiss started developing a scanner that can have a multiplex configuration and scan up to 100 slides a day. And we started taking our foundation model from the IHC space to MIF and enabling a direct analysis of data that comes out of the Zeiss scanner. So this combination then makes it fast, more reproducible, and also data available in let's say a couple of minutes instead of a couple of days.
Okay, fantastic. So it sounds like, between yourselves and Zeiss, you've come up with a pretty groundbreaking innovation there. You mentioned immunofluorescence or multiplex immunofluorescence. Could you explain a little bit about what that is and perhaps get into the science? It's something actually that Inti Zobek mentioned a couple of days ago in a presentation, but with it being ESMO and not a digital pathology conference, it was kind of just an introduction to the subject. It's not something she really managed to get into. So perhaps, Patrick, is that something you could enlighten us on?
Sure, yeah, with pleasure. So multiplex immunofluorescence is really a technology that enables you to visualize different targets on the same slide, and each of them is recorded in a separate channel. So you don't visualize them all in one image, but you actually take sequential images of the same slides with different color channels so that you can see where the targets are expressed on the same slide. That allows you to quantify biomarker expression more in spatial context, to understand the tumor microenvironment better, because you can really see where are the different cell populations. And it's just, in this regard, superior to IHC, immunohistochemistry, where you can only, with traditional approaches, visualize one biomarker per slide, and for the next biomarker you need the next slide, and for the third biomarker you need another slide. So with multiplex immunofluorescence you can really visualize, these days, actually over 100 markers on the same slide if you go to the high-plex regime. And that just gives you an advantage, both in terms of throughput and in accuracy.
Let's continue talking multiplex immunofluorescence. Now, this is something that some labs have already adopted and are using, and a lot of the researchers that use it describe this data as being messy. So with that, they're clearly experiencing a few pain points. PhenoScout AI is harnessing multiplex immunofluorescence. How is it solving some of those problems? Go on, please.
Right. I mean, the chemistry of the assay is super relevant, and having that combined with a scanning device and the AI, so all three compartments, all three parts together, give you the chance to make it much less messy, much more precise, and also much more reproducible.
Yeah.
And this is exactly what we have done. So there are assays that are selected by Zeiss that are stained then in their lab, put on the Zeiss Axis scan, and afterwards also the AI accounts for some variability that comes out of the scanner, but already has the image already has a much better quality than in any other workflow. And this is basically the first time that we come to this reproducible study setup.
Okay. So it sounds like interoperability is a major thing here, like it is in digital pathology. But yeah, this system or workflow that you've created is fundamental, but it's interoperable with Zeiss's equipment as well.
Well, of course. I mean, our whole journey coming from diagnostic routine was a journey of being interoperable with many systems.
Okay.
And in the past, we have integrated into 18 image management systems. And there's no standardized format like in radiology with DICOM. So it's really tedious, it's really a lot of work. It took us many years to get to these different partners, to integrate into them so that we can deploy it easily everywhere in diagnostic routine. Now the Zeiss workflow just uses our standard API to connect, which is then super easy. If we are now, if we want to take the AI to another workflow, like another image source, this is just the same as in diagnostic routine. You can just connect to any other vendor, or they can use our API and basically get images into PhenoScout.
Okay. Well, fantastic answer, thank you. So, you mentioned DICOM there, and, that's been a massive pain point for pathologists for the last, since we went digital, really. Do you think that there'll be an interoperable file type like DICOM that will come along for immunofluorescence?
Well, I certainly hope so, and I certainly hope that it is when I'm still alive. Let's just hope for the best and bring it forward.
As we all know, these things take a long time to happen, don't they? So I'd like to move the conversation on to foundation models. So again, this is something that was at large here at ESMO. We talked a lot about foundation models, VLMs, and agentic AI. Now, PhenoScout AI, I believe, is built on a foundation model. Is that correct?
Yeah, that's absolutely correct.
Okay, fantastic. So, perhaps you could tell us a little bit about the use of foundation models in PhenoScout.
Sure, yeah. So our foundation model is called Peak Foundation. It was derived, if we go back in our history, we come from the clinical application of AI. So we've collected a lot of images and we trained on a lot of different biomarkers to build our clinical products. At some point, we have reached a point where really this underlying model was so good that we thought it has reached the status of a foundation model. So the results and the power of this model is really transferable to different applications. Now this, we found out, we started a lot on IHC, but this now also transfers very well. Since it was trained on hundreds of thousands of slides, it also translates well to the MIF space, which is more or less just another color space that you operate in. So we were very happy that our early work paid off now, using this foundation model in the multiplex immunofluorescence space as well.
Okay, all right, great. So, and please, Felix, yes.
And so there are so many foundation models nowadays around, right? And they are, I would say, in the H&E space, basically commoditized. And you have always the issue that the foundation model doesn't really give you a product, right? And what we have tried to do, and I think to a big extent succeeded, is that we really get cellular segmentations, cellular classes, and segments out of our model. And this to a very pan-tumor, tumor agnostic, and also quite robust way. So this is why I would I'm not sure if we should use actually foundation model, if it's the right term for what we have there,
Okay.
because it's so much associated with just an H&E foundation model where you throw a lot of data on it, don't really pay attention to what it sees, and then have general outputs out of it that are not yet really product ready.
Okay, fantastic. Anything else from you, Patrick?
Yeah, I just wanted to add on that especially in the multiplex immunofluorescence space, it's a lot about small object detection. So we're not talking about patch-wise characterization of tissue, is it invasive tissue or not, but we're really talking about going at the cell level and even at the subcellular level and detecting very small fragments in the image. And this is what our foundation model is particularly good at, and that's why it's more product ready than maybe others that you have heard about.
Okay, brilliant. So there's obviously a lot of companies using foundation models for applications like this. I believe there's a couple of other companies out there doing a similar thing to what you guys are doing with PhenoScout AI. People who are applying technologies like this are interested in its scalability and its speed and its interoperability. Maybe you could talk a little bit about how your technology compares to those.
So to have the complete workflow in really a reproducible fashion and fast with 100 slides is unheard of today. So I think this is really unique. And also, especially the immunofluorescence analysis in the end, what we do with PhenoScout, to not have to spend hours in thresholding, it's also unique to that product. So we are really excited on how it's being used in practice, how and whether it can open the world towards a MIF CDX.
Okay. Yeah. Well, it's amazing what data you can get out of this, and it's something you spoke about, Patrick, before, especially in comparison to just looking at a H&E slide. From a diagnostic point of view, there's so much data to be farmed there, and probably much more to come compared to what we're using at the moment. Okay. So I'd like to move the conversation on to biomarker discovery and validation. Now, I did count, there's 7 different sessions at ESMO on AI and biomarker discovery, so clearly it's a big talking point and something I'd like to talk about with you. Could you tell us a little bit about the application of PhenoScout AI in this domain?
Yeah, sure. So thanks for setting that context. I think that really underscores how important it is for biopharmaceutical industry to discover novel biomarkers and to discover powerful biomarkers. Now, what does multiplex immunofluorescence help here? It's really a technology that you can use very early in the process to identify your mechanisms of action, potential mechanisms of action for your drug, that can then turn into biomarkers for clinical application. And our PhenoScout AI, I think, has 3 main advantages to previous workflows. It's accurate, it's reproducible, and it's scalable. And all of these you need to really speed up your biomarker discovery while still holding up the trust that you have in the results that you might have acquired with earlier workflows.
Okay, fantastic. And validation then, let me ask you about that.
Yeah, for the validation part, I think the same applies. You need a reliable, scalable method that you can use at different sites. And then you can also transfer those results from the multiplex immunofluorescence space, maybe once you have a good hypothesis, to the IHC space, which is closer to clinical applications as of now, which might also change. So by setting this foundation with PhenoScout, you can then easily transition to the validation stage, be it in MIF or in the IHC space.
Okay, well, fantastic. Thank you for that. So, moving the conversation on, I'd like to ask the gentleman about clinical applications for this technology, and when do we think we will see immunofluorescence used in a clinical setting?
Yeah, that's a great question, of course. And if you speak about multiplex immunofluorescence, clinical applicability might not be the first thing you have in mind traditionally. But it's really amazing since we launched PhenoScout AI, how much interest we have received, not only in the early stages of biomarker discovery, but also people asking us, okay, can this go forward to a CDX? Can this go forward to lab application? And I really think with this technology now, it's not so much the question, can it do it, if it will go forward, but more, when will it do that? Because the workflows are getting more and more reproducible and scalable. They're also becoming more affordable. And that really paves the way for application of multiplex immunofluorescence in the clinical setting.
Yeah, and I would say, especially with the high throughput that we offer now with PhenoScout, it will just open the door to so many applications in that field because they see it's possible.
Yeah.
It's actually possible now with that technology. So I think it will take shorter than many people think, and I see it happening in the next 3 to 5 years.
Okay, fantastic. Well, thank you both for that. Now, I believe you have a poster here at ESMO focused on IHC, bit of a different topic, but perhaps we can get into that. You know, I believe it's being hosted tomorrow.
Yeah, that's correct. So I'm actually going to present the poster myself tomorrow. It's new data from a collaboration with AstraZeneca, where we rolled out our HER2 model, HER2 AI model from the IHC space, with particular focus on HER2 ultra-low, to 15 countries worldwide, and we did a pilot study there. To our knowledge, the largest ever AI decision support study that was done, with over 2,000 patients, 9 different scanners, and also a microscope camera involved. And we're going to show very exciting updates on the data from this study.
Okay. Well, it's really exciting, actually. Unfortunately, I'm not going to be here on Monday, but, you know, I wish I was. So, obviously, the field that we work in is incredibly fast-moving, fast-paced, and science changes on a daily basis, especially in pharmaceuticals. Perhaps we can touch on why spatial biology as a field and this product, PhenoScout AI, is more significant than it would have been 10 years ago or at any other point.
Yeah, exactly. I think now is really the age for spatial biology, because we have seen in the clinical trials over the last decade that therapeutics need to be increasingly complex to achieve an advantage over the standard of care. And with those next generation of therapeutics, for example, bispecific drugs, ADCs, and also multi-specific IDCs, we also need a new generation of diagnostics. So since those ADCs cover so many different targets, an understanding of the tumor microenvironment and the spatial biology in the tissue is more essential than ever to validate biomarkers for those complex drugs.
Okay, fantastic answer. I'm really glad that we managed to cover that. I think final question from me then, how might the use of AI in diagnostic workflows change the way oncologists and pathologists collaborate on treatment decisions? Just to add something to that as well, you know, this is something that we talked about at length with the use of agentic AI, and, you know, one day not even having a pathologist or a radiologist and having just a diagnostician who can deal with both forms of data.
Well, I think there are two parts of it. The one is generating data, and when you look into the hematology space, it's totally normal that there is a lab and a machine that looks at the blood and gives data out, and the doctor checks that data and signs off on it. And I believe that this could be a way forward for the pathological analysis. Now, the oncological analysis is a little bit of a different topic, because here we take decisions, and those decisions are severe. So at the same time, I believe that agentic AI, can help a lot to boost the oncologist, because it just can read all the papers in the world, always. Yeah. It can stay up to date with all new clinical trials and all results that are out there in literature, and recommend certain treatments. So as long as we have a certain way of explaining why they recommend the treatments, and I think this will be possible in the future, then I think it will super boost oncologists in an incredible way.
Yeah. Well, I like the idea of that, certainly. I think, well, that's about time for me to wrap up, actually. One last question for them, Ben. So looking into the future, now that we have PhenoScout AI, what is the broader vision for it? And what is the broader vision for Mindpeak? You know, is there going to be new product releases on the way?
So I think there's so much to discover in the pathology space, so much data in one slide that needs to be uncovered. And AI can be such a big help in doing that. And if you think about it, we have so much to discover in those different tumor types, different staining types. There's still a lot of work to do. And once we discover that and we help connecting the right treatment to the right patient, we can make it even better by adding different modalities. So creating multi-omics biomarkers, which we have already started. So it's starting out now.
Yeah.
And I believe 10 years we will be looking back at that time and think, oh my God, how did we diagnose today?
Yeah.
And I think that's a good thing.
I would totally agree here. I wouldn't hesitate to say that we are currently experiencing a revolution in the biomarker field, because we have new technology, we have also a growing need, but we have the technology to tackle it. And just as Felix said, I think it's the dawn of a new generation, both in terms of the biomarkers and the drugs and the value we can bring to patients at the end.
Thank you, and I think that's a lovely way to wrap up, actually. Kind of the vision of us looking back on ourselves now and thinking, well, how the hell did we do that? But there you go. Well, thank you both very much for coming to join me today at ESMO. I really enjoyed our conversation, and I'll look forward to the next one.
Yeah, thank you so much for the invitation.
Yeah.
Looking forward to it as well.
Yeah,
Pleasure.
great. Okay, goodbye.